Disc replacement recovery. After your surgery, there are several precautions to follow. No bending directly over, putting pressure on the incision, no twisting or quick movements of the neck or back, and no lifting over 5 to 8 pounds, which is roughly equivalent to a gallon of milk. Remember, this includes no lifting of pets, children, laundry basket, vacuum, and other common household items. If you have any pets, it is important to make arrangements for someone to walk them for the first few weeks. We do not want a pet pulling on you, nor do we want you to trip while trying to walk them. Tasks like holding a book or a phone or being on a computer for a long period of time can affect the neck and or back muscles. It is important to give yourself time to heal. The more stress you put on your body initially, the less your body is able to focus on healing. Therefore, major things like cooking, cleaning, and or doing laundry needs to be avoided until released to do so by your surgeon. Usually at the 2 to 3 week mark, you will have a follow-up with your surgeon. At this appointment, or a few days prior, an X-ray will be taken to determine how well you are healing. The surgeon will evaluate your symptoms, if any, and determine if your precautions need to remain in place.